Hello viewers. So it has been done. The Ontario Conservatives, after not even hinting at the plan during the 2022 summer election, have passed a plan to privatize medical services and open for-profit clinics in Ontario. The reason why is because ERs, quite frankly, are overloaded and people are waiting too long for service, which is a real problem that needs to be addressed. Unfortunately, this plan will fail, and it sucks resources out of our public hospitals and the COVID-related problems we face in hospital and ER care. And because 9 out of the 10 provinces in Canada are run by Conservatives in the year 2023, other provinces are likewise passing various privatization plans and schemes all the way from Nova Scotia to Alberta, so it's not just Ontario. These problems are made worse by the fact that every mainstream Canadian media outlet has been on a campaign to state how our hospitals are failing, and then they always, without skipping a beat, will always ask, will private medical services resolve the issue? As a follow-up question in every single report they do. If that isn't inserting bias into every single report, I don't know what is. However, first, I'd like to do something our corporate Canadian mainstream media are failing miserably to do when reporting the hospital crisis. Mainstream outlets are not doing any comparative analysis. Guess what? This COVID-related hospital crisis, which is rooted in staffing problems, and particularly nurses who are quitting the job due to stress, the crisis we're describing also afflicts the US, it afflicts Europe, it afflicts Australia, and most healthcare systems around the world. This isn't a Canadian problem. So I did a quick search online and found these independent news clips, and I'll link them below in the video. You can watch the whole report. So here's a few clips I've found thus far.
Have to wait a little bit longer to be seen. Clyde L. Jefferson reached out to us with this question. He claims Ochsner Health System is making people wait in the emergency room for 16 hours or more.
We don't have the staff to sustain added patient load. Tonight, we're hearing from a family going through it firsthand. WREG's Shay Arthur is live at Methodist South tonight in Whitehaven after speaking to a family who waited 50 hours to see a doctor. And Shay,
emergency rooms in Massachusetts have been pushed to their limits and beyond several times over the course of the pandemic. And as we head into our third winter with COVID reduced but still here, we're already seeing hospitals more overrun than ever. The Boston Globe reports on absurd wait times for a bed. 8 hours in one case, even more in others.
Emergency rooms are so overwhelmed, they're telling ambulances to take their patients somewhere else.
Honestly, it's been like we're in a mass casualty disaster every single shift.
Paramedics are waiting with patients in their ambulances or in hallways for hours just to get them admitted to the ER.
All of our beds are full. We got people everywhere we can.
Is our healthcare system at a breaking point right now?
We're close to it.
So, those are the facts, folks. North, south, east, west, from Boston, Maryland, Florida to Memphis, Seattle to Los Angeles, all over the US, in many locations, you find the exact same COVID-related hospital crisis in one of the world's most privatized healthcare systems, where the majority of medical services are delivered on a for-profit basis. And a personal note to add, I have a family member who lives in Tennessee who just waited 13 months for a knee replacement surgery in a hospital system in Chattanooga. She received good care. I mean, the reports I got, she got a good surgery, she got the surgery. She's covered under Medicare, so that should be covered. But she did wait 13 months after a significant wait for the other knee, which I think was even longer. So, friends, these long waits for medical care are all over the United States. Clearly, this is not a Canadian medical problem. Now, with these facts established, I want to turn back here in Canada, and particularly to Ontario, where I live, as of 2023. We do need improvements in our hospitals. We've got the same problem here. You've got cases of people in absurd hospital lineups that are happening, especially whenever there's an outbreak of something. Elective surgery waits are too long, and emergency medicine in hospitals are taking too long, especially, like I said, during COVID, flu, and RSV outbreaks. So how should we fix our wait time problems? Well, Doug Ford and his Conservative government here in Ontario have decided to use the global COVID-related hospital staffing crisis with its delays in emergency medicine and surgeries to seize an opportunity to privatize our healthcare system. And it's going to be opening up private for-profit clinics to do non-emergency procedures like knee replacements, hip replacements, cataract surgeries, taking it supposedly out of the hospital setting into these private clinics. His government openly states it will cost conservatively 30% more to OHIP, the source will be linked below, 30% more billed to our public insurance plan to operate these for-profit clinics. Now, I estimate that is way low. I know private care from the States. These clinics will argue, lobby, and try to force OHIP to pay much, much more in the coming years. So 30% is not even a starting point. But at least the Conservative government admits they're wasting that much money on this project. Anytime a private for-profit clinic charges more for its services, and this is important, that is less money for hospitals, less ability to increase payouts for other services like nurses' salaries, which is the core of our problem. Less money for public hospital systems, which is where the COVID-related staffing shortages are the most serious, is actually going to make our hospital crisis worse in Ontario and the other provinces trying these schemes out right across Canada. Now, again, let me be clear. For-profit, private medical clinics doing the easy surgeries will take funding away from our public hospitals under the Ontario Conservatives' plan. That will make our hospital crisis worse, not better. Can't repeat that enough. I'm not just saying this. The Ford government openly says it will cost more for private clinics. These clinics will not, they will be allowed actually to ask patients to pay for so-called premium services above what the public system covers. So they will be asked to bring out their credit cards, Mr. Ford, not their OHIP card, to pay for their medical services. This is absolutely going to happen. It will happen under the Ford's Conservatives medical plan. The first time in Ontario this has ever been openly tried. But let's reverse a bit and go back to the hospital situation. Ontario hospitals are overworked, they're understaffed, and they're filled to the brim and have been pushed to the brink because of COVID. It's a global problem. This is not a Canadian problem. COVID has caused stressing in the nursing and doctor system in our province, in the hospital system. So the problem in Ontario originates as a hospital problem, particularly with emergency care. ICU and emergency care is where the problem is most visible. What does the Doug Ford Conservatives plan do to help hospitals? Well, it does nothing. His claim is that offloading simple procedures like cataract surgeries onto these private clinics is going to free up hospitals to have more ER care. There's no evidence this will work. That's not how hospitals work. Elective surgeries are completely different from emergency medicine. He doesn't seem to get the memo on that. On the contrary, if we look at Australia, a country that has a fully public Medicare system like Canada, and unlike Canada, they have a fully developed, for-profit, private medical system already sitting beside its existing hospitals. By all accounts, Australia has fared worse during COVID. Public hospitals in Australia, which take care of the vast majority of emergency and elective care, have had longer waits and more staff shortages and more problems than in Canada. You can search that up. I'm not going to go into detail, but so basically if Doug Ford's plans have any chance of success, you'd expect a system like Australia, which is a better example than the US, to be a shining example of what we can look up to. Unfortunately, Australia is experiencing longer ER waits on average. More elective surgeries are backlogged for even longer periods of time than the average here in Canada. And the reason is clear. It's more clear than people realize. These private clinics in Australia are drawing staff. There's only a limited number of staff, like in a country. It draws staff out of public hospitals, out of public Medicare, into these private clinics. So there's only so many nurses and doctors to go around. So let's repeat these facts, just so we're clear. First, the globe has a real hospital care problem that is COVID related. The reason why nurses and doctors in emergency medicine have faced incredibly bad working conditions, it's a fact that they have, I should say, with many nurses reporting having to work mandatory overtime as the expectation of the job, working 50, 60, sometimes even absurd 80-hour work week, sleeping at the hospital basically after pulling a double shift every day. This isn't sustainable, and the stress of having to deal with the sickest COVID patients, many of whom refuse to vaccinate in order to stay out of hospital, that doesn't help. So why would you, if you're a nurse, want to remain working? If you've got these patients that are the sickest of the sick and your coworkers are leaving and then you're expected to pick up the slack, it doesn't work. That's the problem in a nutshell. Here in Ontario, our Conservative government passed Bill 124 several years ago, which limits nurse pay increases to 1% a year. Takes away the union's ability to negotiate. And this is happening at a time when we're experiencing 6 to 8% inflation on an annual basis. The numbers don't work to incentivize nurses to stay in the profession. That's the problem. The Ontario Conservative government has failed miserably in its privatization scheme. It is exacerbating the hospital crisis, and the few surgeries that will be offloaded in the private for-profit clinics will not free up hospitals. It doesn't create more emergency medicine. The evidence is borne out in the Australian experience, and furthermore, Doug Ford has no plan to pay nurses more, attract more workers, and he has no credible plan to double the nurses working in our hospitals, which is what really is needed at minimum. So folks, we have a massive scam going on in Ontario healthcare. Our hospitals are going to face further funding problems. The Conservatives are still trying to cut nurse pay and benefits, limiting unions negotiating for better conditions, and the existing staff that we have will be lured out of the public system now without any credible plan to increase staffing under this privatization scheme. This is just a massive, massive failure in the making. Sure, you might be able to find a few cataract or knee replacement surgeries that will happen somewhat quicker with this plan, but our hospitals are going to continue to deteriorate in Ontario. You can count on it. With this plan, this is a failed Conservative plan. After observing other systems and our own, this is what I think will help Canadian medical care more than anything. First, let's prioritize training new nurses and doctors, make it much easier for prospective students to enroll in and get through Canadian medical schools for doctors, for nursing, and other medical fields too. That means prioritizing education, building new facilities to get nurses and medical technicians into the system. Secondly, let's cancel this privatization mess and reinvest into our public hospitals. That means not using catchphrases like efficiency or doing more with less, when frankly we need more spending. We need less efficiency. We need more spending and more nurses. More pay for nurses, not less. Lastly, let's build new hospitals. Not just replace old hospitals with new buildings, but since the 1970s, hospital bed counts have been going down and down and down and down, even as we build new hospitals. I realized after doing research what is happening right across North America. And yes, this is a problem in the US too, where states like Tennessee have had over 10 rural hospitals closed in the last decade. You can check that out. That's completely factual. I'll link an article below for you to read that. But here in Canada, we have hospital shrinkage too. We need to reverse this by building new hospitals, not just consolidating hospitals into mega hospitals. Lastly, we need to ensure that all Canadians have basic, non-emergency medical care, even if they don't have a family doctor outside of a hospital setting. Too many patients are showing up in ERs that don't have truly emergent needs, and part of that is because we need to encourage the development of and use of urgent care clinics, team family medical environments, or facilities that are more appropriate for care that's really not needed for an ER. I believe that if we increase education slots for nurses, for doctors, and medical professionals like an MRI or sonogram tech, and we push hard for students to enter the field, and if we increase pay and basically mandate that nurses are not obligated to work overtime at all and respect the union negotiating table where workers have a fair deal, you combine all this with a new hospital investment in new facilities and more beds, we can resolve our hospital crisis. Otherwise, we're just throwing money out that might help some people like a cataract patient, but does nothing to address the ER waits that are high and why hospitals are stressed. Because at the end of the day, Ontario and Canada's problem stem from overstressed hospitals. Offloading a few of the easiest performed surgeries while having no staffing replacement or enhancement programs for the ER, that doesn't address the problem. And that, my friends, is basically it. You need to get out there, email your provincial government officials, express your displeasure with the Ford government's privatization scheme, the for-profit plan. You have to press back against the Canadian media that have been actively promoting privatization in media reports. You have to contact your federal government, tell them, look, whole province is accountable. Any money that's released to the provinces cannot be used for private for-profit clinics. The federal government needs to press that on these governments. So we can only improve public Medicare in Canada if the public re-engages, like they did 50 years ago, 70 years ago. Because we all need to remember, the Canadian Medicare system was created not from doctors, but because the public sector demanded it, because people demanded it. Doctors weren't always keen on the idea. Some were, many weren't. And it was the public and our elected leaders that created the framework for this system that does work. Our system has been hugely successful, and it is not collapsed. By all measures, though, we still have a functioning health system that works good overall. But these COVID-related health crises need to be addressed. We're not going to solve this problem with efficiency and doing more with less. We have to invest more into hospitals, build more of them, pay nurses more, allow unions to negotiate that overtime is not a requirement, for example, of the job. We have to educate enough workers, incentivize them back into medicine. If we don't do this, we will have a failed system, no matter whether it's public or private and sucking dollars out of your pocket and denying treatments. I think Canada deserves better than these miserable conservative governments telling us we have to have privatization as a solution. So get out there. Fight for public hospitals. Fight for publicly funded, publicly delivered, free with no fee-based offering of health services. Canada, we need to make sure public Medicare is upheld, not destroyed, because privatization forces have seized on this COVID crisis. We are better than that. Thank you for watching.